LGBTQ2S communities are indeed among the most impacted by food insecurity. Anecdotally, for us who work in that industry, on the ground, this is something we see day in and day out. But beyond that, there are actually several studies conducted, American-based for the most part, that report food insecurity among LGBTQ2S adults is more than double the national food insecurity rate. To note, within that, LGBTQ2S folks of color are more than doubly affected within that number. A lot of the reason for that, I think, is that queer and trans folks experience higher rates of poverty, joblessness, homelessness, and those are factors that drive the risk for food insecurity. In addition, sort of lack of access to healthy, nutritious, and sufficient food is a social determinant of health. A lack of food can exacerbate chronic illnesses, cause stress, impact mental health, which, in turn might impact somebody's ability to work or care for themselves and worsen the problem. And within our own sort of frozen meal program, which I will talk a bit more about later, we ask folks when they register just for some optional demographic information to better get to know who we're serving. And despite the fact that our program's open to anyone and the only criteria is that you have to be able to come pick up the food or send someone to do it on your behalf, more than 60% of the folks who have signed up and accessing our services are LGBTQ2S identified. COVID-19 has amplified and impacted definitely food insecurity among our communities. I think there's a few different factors to that. Firstly, obviously, COVID has had a devastating effect on many industries, and a number of folks were unfortunately laid off or lost their jobs. Clearly, a lack or decrease in income reduces many people's abilities to make ends meet and to be able to purchase food for themselves and their families. So this caused folks who were not previously food insecure to become so. But I also think it's important to note that aside from causing or worsening food insecurity, we have to remember this is nothing new and it's always been there pre-COVID. COVID had just brought that to light. And I think unfortunately there is and has always been a stigma for around asking for help or accessing food support services. So we've seen many folks in the past who would prefer to go hungry or do without rather than admit that they're facing that issue in their lives. But this world is not the world we're used to living in. And I think with all the loss and devastation brought on by this pandemic, we're seeing a lot of folks reach out for the first time and sort of being willing to reach over and reach past the barriers that prevented them from doing so in the past. And then additionally, I think a reason why we at the 519 specifically have seen an increase in the number of folks coming to us to access food support. At the start of the pandemic last March, a number of organizations that previously offered in-person meal programs and drop-ins ceased their services, particularly right at the beginning, as they took time to re-examine how they could modify their services to continue to operate. The 519 did not cease operating whatsoever. We immediately pivoted our services, redeployed our staff to meet the urgent needs of our communities by offering twice daily hot takeaway meals. So this led to folks who had previously accessing services elsewhere and not via us come to us. And what we found was that once other organizations resumed offering meals, we had already formed meaningful relationships with many of those folks through our daily interactions. And a lot of people chose to continue to come to us to access our food services instead of others. And, it's gratifying to receive a lot of feedback and the sentiment from the community that we're grateful for our support and that recognize the 519 was there when nobody else was for them. And that we've really built these relationships of trust and support with our community members.
The 519, your community center.